Hey, good afternoon. Welcome to our Halloween edition of our live Facebook video today. I am Dr. Alex Kallio, Clinic and Owner Director here at Comfort Family Chiropractic, or today, Dr. Marty McFly, going back to the 80s and back to the future for Halloween. So we are going to talk today, kind of aptly since it's Halloween, about being scared of the chiropractor. I am sure some people out there maybe that might jump on with us or certainly see this video at some point that have thought about going to the chiropractor but have been scared for one reason or another. In nearly 20 years in practice, I have heard all the different excuses of why someone might be scared to go to the chiropractor. They've thought about going for a long time, but just never could quite pull the trigger. And there's a lot of reasons. Certainly some people are just scared of the popping sound that might happen. They're scared of finding out there might be something wrong. Or maybe they've heard kind of a myriad of misinformation out there of what actually might happen at the chiropractor. And usually a combination of those things why somebody could be scared to actually see a chiropractor. So today we're going to dive in kind of to this Halloween theme and talk about why is the chiropractor so scary, and maybe kind of help calm a little bit of that, dispel some of the myths, and certainly help you maybe see if chiropractic has something to offer for your condition. So for those of you, again, I introduced myself once, but again, I am Dr. Alex Kallio. I'm the owner clinic director here at Comfort Family Chiropractic in Lincoln. As I mentioned, I have been in practice for nearly 20 years. And I've been at this a long time. So we've seen tons of conditions, from headaches to back pain to nerve issues, disc problems, those kind of things, and everything in between. And many times can help those things. But there are many times, many people out there that aren't going to a chiropractor for one reason or another. So this video today is really meant for them. Certainly whether it's a family member or a friend, somebody that you know, maybe you've been trying to talk them into seeing a chiropractor, maybe it's yourself. But this video is really meant for you today, and we're going to talk about the scary things of going to a chiropractor and help maybe shed some light on that. But if you're jumping on with us, be sure to hit that like button, hit the share button. We want to get this video out to as many people as we can. So certainly be sure to share this with others so we can share this message today. And then definitely comments, definitely as we go here, maybe share your story. If you had been scared about going into the chiropractor before, or a little trepidation about going, but ended up coming in, and obviously share your experience in the comments below. It certainly can help people kind of see that too. So, the vast majority of our patients, when we get people come in that, haven't been to a chiropractor before, or a little nervous or apprehensive, usually once we get that first treatment done, they wish they'd come in a long time ago. It's not so scary. And so, again, we kind of look at the excuses or the thoughts of why somebody wouldn't want to go to a chiropractor. One of the first things, that many people will say is they don't like the popping. They don't like the popping sound or the cracking sound. And certainly, any joint can pop. If you stretch or move, you can feel things pop. Of course, a lot of people will pop their knuckles, that kind of thing. All the popping sound is air, or specifically carbon dioxide, that's released within the fluid that surrounds the joint. So when we have joints that come together that allow movement within our spine, there's a fluid-filled sac that surrounds that lubricates the joint, that allows it to move. And when we open, or we stretch or move or get adjusted, those joints are kind of opened up quickly. We get an air release from within that fluid, and that's what makes the popping sound. It's not bone grinding on bone or anything like that. And typically the pop isn't really what a chiropractor is trying to do. The pop really is incidental. We have techniques that we do that don't cause any popping at all. Other techniques, of course, more manual type adjusting, that do. The pop really doesn't matter. The biggest thing when we start looking at improving alignment, improving function of a joint, improving motion mechanics, all of those things are accomplished through an adjustment, and typically that feels like a good pressure release. Most of our patients will describe it as feeling like pressure coming off of the area. Typically feels very good. It's not painful or uncomfortable most of the time. And typically there, again, some techniques, such as what's called an activator, uses a little handheld adjusting tool that doesn't cause any popping at all, can be used for those that are really nervous about it, or in conditions that are contraindicated to having a more manual adjustment. So all depending on what we find through a good thorough exam, potentially x-rays, those type of things will determine what technique is best for that condition. So, there may be conditions or people that come in that don't ever get a popping type of adjustment. They get more gentle techniques done. muscular work, those kind of things, and others that will get a more manual technique. But that's all determined by having a good exam, good initial intake done, and practitioners that really focus on getting a good intake, good exam, thorough diagnosis are going to get the best outcomes when it comes to treating different conditions. So the pop really shouldn't be so scary. You know, most of you, when you're stretching, moving around the day, you'll feel things pop, and that is completely normal. And again, some adjustments will do that, but it's not the main thing that we're trying to do. So if you're someone that is nervous about having the popping done, talk to us. There are techniques that we do that don't do any popping at all. So if you're nervous about that, we can certainly put that kind of nervous portion to bed there. Many techniques that we can do that don't involve that at all, or progress somebody as they get more comfortable toward that. Secondly, you know, a lot of people get nervous, scared to go to a chiropractor because they don't want to know what's wrong with their spine. You know they have an issue and they've decided they just don't want to know what's wrong. You know, it might be a surgery or it might be, you know, other bigger things going on. Obviously, from a healthcare standpoint, any physician would tell you that's kind of a bad route to go. You know, the old saying is, you know, if it's not getting better, it's getting worse. And, you know, really they're kind of really true when it comes to the spine. You know, many hidden conditions there that can be progressive, such as arthritis and disc problems, things like that, that because we can't see our spine on a day-to-day basis, you know, most people are basing what their health of their spine is by how they feel. And we can have a lot of issues that are present and kind of really progressing for the worse, but not really have a lot of pain, or it's symptoms that we kind of sweep under the rug and blame on age. I'm getting older, you know, it's supposed to hurt that way. I hurt every morning, but I've done that for years. We kind of make excuses as to why we hurt. Those are things we really need to get examined and really should start much, much earlier. You know, really, in an ideal realm, we would say the best time to start seeing a chiropractor is right after birth. You know, we really should start as a baby getting well checks, much like we do the dentist. You know, we start as a young child getting dental checks and kind of working to keep our teeth healthy. Our spines really should be the same way. So the earlier the better, but it's never too late to start getting those things evaluated. And again, it starts with a good history, a good exam, potentially x-rays through there to get a look and really get a diagnosis established. And certainly from a chiropractic standpoint, you know, we really are experts in treating musculoskeletal conditions. Bone, joint, muscle, nerve issues, everything ranging from disc and nerve compressive conditions, you know, to kind of more simple muscular things. But that's what we excel in treating and really are the experts in treating. So it's why when you go to see your medical doctor, you know, for back pain or even headaches or you know, shoulder pain, those kind of things, really all you're going to get is an anti-inflammatory muscle relaxer pain pill to go home, but it's not actually fixing anything. It's not going to heal the tissue. It's not going to improve your alignment. It's not going to improve the function of those things. That is what a chiropractor does. And really, again, if you're dealing with those kinds of things, it's almost a must that you see a chiropractor if you want to really help take care of that condition. You have an infection, you have, you know, cancer, you have a broken bone, don't come see me. Don't come see the chiropractor. That is not things that we are going to take care of. That is what your medical doctor is for. Excuse me, for those medical related conditions. But if you have back pain, headaches, shoulder pain, you know, knee pain, any of those kind of things, you know, nerve, disc issues, that is what a chiropractor is for. And really what we are the experts and really the primary experts in treating those things. So, you know, that kind of stuff, you know, sure, if you've got a lot of pain, go see your medical doctor, you know, get your anti-inflammatory or whatever to start with, but then you need to make it into a chiropractor's office and we will diagnose those things much more thoroughly, get a treatment plan set up that's going to address that, and certainly get you back to doing things, you know, way better than you have been before. You know, and then when we look at certainly some of the misinformation that's out there regarding chiropractic, you know, you can go, good old Dr. Google or online and find all kinds of crazy things out there. And what I'll say on that side of things is typically, again, I've been in practice for almost 20 years. Not one time in that 20 years have I ever had an accident or injury happen to a patient, and none of my colleagues or friends that I know have ever had that kind of thing happen either. Statistics bear it out. You are way more likely to get hurt or have an injury driving a car, even seeing your medical doctor, than you are at a chiropractor's office. And certainly the biggest thing I can relate to you as far as the safety and effectiveness of a chiropractor is to look at malpractice insurance rate. Even everything from your surgeon, which is going to carry probably the highest malpractice rate in 6 figures a year to have insurance, down to your general practicing medical doctor. It's still getting into double-digit tens of thousands a year in malpractice insurance. A chiropractor's malpractice insurance runs typically about $1,000 a year. It is the cheapest malpractice rates out there of any practicing physician, and that is the #1 indicator for safety there. So when it comes to seeing a chiropractor, we can really take the scary out of it and let you know that you are in the safest hands possible when it comes to treatment, and certainly when it comes to satisfaction of treatment. Several studies out there showing most patients under chiropractic care are reporting 95% satisfaction rates with care. You don't get those kind of satisfaction rates without having good results and having good safety involved with that. So if you're out there suffering with neck pain, headaches, back pain, sciatica, disc issues, those types of things, go see a chiropractor. And certainly if you're in the Lincoln area, give us a call. We're Comfort Family Chiropractic. We are located in lots of areas. You can find us obviously here on Facebook at Comfort Family Chiropractic. You can find us on the web at www.comfortlincoln.com. You can certainly send us an appointment request on there or send us in a question. Obviously, if you have a question, comment below. We keep an eye on these things. We watch for people posting here. So comment your question. Again, if you're watching this later and have had a experience before being nervous about going to the chiropractor, tell us about it. Comment in, let us know, and be sure to share this video out. And we hope to kind of make seeing the chiropractor a little less scary, and we hope to see you in our office soon. And have a happy Halloween, have a safe night trick-or-treating, and we'll see you all next week.